First, I greatly appreciate being here with so many outstanding investigators in our field. And I'll start. Recently, we haven't seen great strides in new radiosensitizers in head and neck cancer. And therefore, John asked me to discuss a specific preclinical example of using dual targeted agents in combination with radiation as radiosensitizers. So today I'll talk about how we can potentially manipulate STAT-3 in order to augment cetuximab-induced radiosensitization. The epidermal growth factor receptor has been an important target in head and neck cancer, and the EGFR targeting monoclonal antibody cetuximab has become an important aspect of our treatment armamentarium in head and neck cancer. These are the results of our phase 3 trial for local regionally advanced head and neck cancer patients who were treated with primary radiotherapy with or without cetuximab. The addition of cetuximab to radiotherapy demonstrated an improvement in local regional control, as shown on the left, and an improvement in overall survival, as shown on the right. Early on, we noted that cetuximab, or C225, accentuated radiation-induced apoptosis in head and neck cancer. We first presented this in an abstract in 1996, and we published it in 99, and this one is in 2000. Subsequently, we became interested in the signal transducer and activator of transcription 3 protein, or STAT-3. It's a mouthful. And we became interested in this agent because of its protective effect on apoptosis. It became evident through multiple investigators that cetuximab decreased the activation of STAT-3 as part of inhibiting the EGFR signaling process. So therefore, we began to explore STAT-3 knockdown head and neck cancer cell lines. We utilized a short hairpin RNA structure against STAT-3 in human squamous cell 5 cells that we acquired from Tom Carey at the University of Michigan. One can see that we achieved approximately a 40 to 50% knockdown of STAT-3 in these 2.4 and 2.9 cell lines. And these are the negative controls that were transfected with a mutant sequence. And these are the parent 5 cells. So what do we find? The STAT-3 knockdown cells were more radiosensitive, as shown here. The parent line is shown in purple. And this is a standard colony formation assay with radiation dose on the abscissa and surviving fraction on the ordinate. The negative control shown in dark green. The two STAT-3 knockdown lines are shown in brown and blue. So distinctively more radiosensitive with the STAT-3 knockdown. Well, then moving on from, before I move on, we also showed that the STAT-3 knockdown cells were more sensitive to radiation-induced apoptosis, as one would expect from STAT-3's mechanism of action. Well, then moving on from radiation to cetuximab, we explored the anti-proliferative effects of cetuximab on these STAT-3 knockdown cells. And you can see the two STAT-3 knockdown cells over here, control and treated with cetuximab over 72 hours, 5 micrograms per milliliter. And they were substantially more sensitive to cetuximab compared to the control cell lines in this proliferation assay. So next, we went on to explore cetuximab-induced apoptosis, as shown in green, and cetuximab-induced DNA damage, as shown in orange, in both the STAT-3 knockdown cells and the negative controls. And one can see that the STAT-3 knockdown cells demonstrated greater cetuximab-induced apoptosis compared to control cells in both the STAT-3 knockdown cells, and greater DNA damage as measured by an alkaline comet assay. So therefore, at this point, STAT-3 knockdown improved the anti-tumor effects of radiation and cetuximab. And based on these knockdown experiments, we became interested in whether STAT-3 may be an important target for accentuating the effects of cetuximab. We know that cetuximab only partially inhibits STAT-3, and the question arose whether a Janus kinase STAT-3 inhibitor could improve the results of a cetuximab-induced radiosensitization. This schematic illustrates the use of cetuximab in combination with Janus kinase, or a JAK inhibitor, in an effort to decrease STAT-3 activation. In other words, we're attempting to use cetuximab at the cell membrane and a Janus kinase inhibitor, so two different steps in the EGFR signaling process to see if we can augment the effects of cetuximab. So what do we find? Well, initially we explored the combination of cetuximab and JAK1 STAT inhibitor that was purchased from Cal Biochem. And this is a JAK1 inhibitor that has not been used in patients. And these are immunoblots that show exposures to the agents over 8 hours and 24 hours. And I'd just like to draw your attention to the exposures where cells were spiked with EGF at the end of the drug exposure. And you can see here for the most important form of activated STAT-3, control, cetuximab, a slight reduction, JAK1 inhibition, a slight reduction, the combination of the agents, marked reduction in STAT-3. Same thing is true at 24 hours. So that was encouraging for us to move on. So next, we looked at cetuximab and the JAK1 inhibitor with radiation, and we saw that the JAK1 inhibition enhanced cetuximab-induced radiation as measured by a decrease in cell proliferation, and that's shown in green, and an increase in apoptosis as shown here in red. So the cetuximab and JAK with radiation shown here by the last curve, and that's a decrement in proliferation. Cetuximab and JAK1 inhibition with radiation for apoptosis, more apoptosis for the dual inhibition as shown here. So then we wanted to move on to whether or not the dual inhibition affected the induction of radiation-induced DNA double-strand breaks. As we know that radiation, an important aspect of the radiation mechanism is DNA damage. And we knew from previous studies that cetuximab did not increase the induction of DNA double-strand breaks in our head and neck cell lines. And this slide demonstrates that the induction of radiation-induced DNA double-strand breaks in the UM1 lines, as shown in these bar graphs for radiation alone, cetuximab and radiation, JAK1 and radiation, and then the dual inhibition. These conditions, radiation compared to any of the potential radiosensitizers, were not statistically different. So no difference in induction of radiation-induced DNA damage. And that was not surprising. However, moving on to DNA repair, we also knew that cetuximab resulted in prolongation of radiation-induced DNA double-strand breaks in head and neck lines. And we had shown that in our head and neck lines as well. But that was initially outlined by Dittman and Rodman in approximately 2007 or so. And at first, it was not received very well, but it's become more accepted as an important aspect of the mechanism of cetuximab-induced radiosensitization. So here we have 4 cell lines consisting of the UM1 line, the UM5 line, which is our parent line, the STAT-3 knockdown cells, the 2.4 and the 2.9. And then we examined repair of radiation-induced DNA double-strand breaks at 6 hours and 4 hours after radiation in all 4 of these cell lines. And so what do we find? It's a little confusing, and I apologize for that. But let's take a look just at the 24-hour point. If you look at radiation alone, this is the amount of repair that has occurred by a neutral comet assay over 24 hours. And we want to use this as our reference because You see less repair with cetuximab and radiation. Also, you see less repair with the JAK1 inhibitor and radiation compared to radiation alone. But you see the greatest decrement in radiation-induced repair when we use both agents. So that was intriguing to us. So next, that was a JAK1 inhibitor that was not used in patients. And so we wanted to move on and progress in this project and hopefully move towards treating patients. So we looked at a JAK2 inhibitor, and this agent was previously used in patients in a phase 1 trial by Bristol Myers. And we worked out a grant with Bristol Myers to explore this agent. We found that this agent also showed an enhancement of cetuximab-induced radiosensitization with respect to colony formation. And just pointing out some of the preliminary results, some of the results here, control cells in black, cetuximab and radiation in green, so some radiosensitization. The JAK1 and JAK2 inhibitor, some radiosensitization as well. And then the combination of JAK and cetuximab together with radiation marked radiosensitization. So the JAK2 inhibitor also resulted in radiosensitization. And I took out several slides. I don't have time to show you the same background that we showed you for the JAK1 inhibitor, but suffice it to say the results for the JAK1 inhibitor and the JAK2 inhibitor were quite similar. Well, moving on with our project, hoping to get to a point where we can go clinical, we looked at the UM1 cells as xenografts, and we found that when we inhibited growth with the dual inhibitors and radiation, we had the maximum growth delay. And one can see the different conditions in this experiment of xenografts. Cetuximab by itself, we used a low dose of cetuximab up here in green. Cetuximab and radiation marked radiosensitization. Cetuximab and the BMS agent, the JAK2 inhibitor, right here. So similar to JAK2 and cetuximab, similar radiosensitization. All three agents, or the dual inhibition with radiation, showed the greatest decrement in xenograft proliferation. So we were quite excited about that. So the combination of EGFR inhibitors and STAT-3 inhibitors is very intriguing, and we hope to continue to explore this combination in the lab and the clinic. I had hoped that I would be able to tell you that we have a clinical trial ready to go, but Bristol Myers has just decided to discontinue work on this agent. And so, in summary, at this point, the JAK-STAT pathway inhibits apoptosis, proliferation, and cellular immunity. The recent findings that JAK-STAT inhibitors inhibit PD-L1 and PD-L2 expression in certain tumors is very interesting. And I'm not the first to mention that. Margaret Shipp, a few years back, mentioned that in a manuscript and hypothesized that it might be useful to combine the JAK inhibitors with the PD inhibitors. And so more to come in that avenue. So therefore, as I just mentioned, it may be possible to use the JAK-STAT inhibitors as enhancers of the PD inhibitors in the future. And this strategy and other combinations warrant further exploration. But as the group mentioned this morning, Ezra, Quinn, and Everett all talked about potential combinations. And there are many exciting combinations out there, but we certainly need to understand the mechanisms of interaction more fully before we just jump in on certain combinations. And that's getting harder and harder with some of these targeted agents. So finally, these are the current JAK-STAT inhibitors that are undergoing clinical trials for cancers in the United States. The future integration of these agents into our treatment armamentarium will hopefully be fruitful. You can see that we are currently exploring gastric cancer, lung cancer, pancreatic cancer, quite a few lung cancers here. Really, no one is exploring head and neck cancer, so we hope to get there at some point quickly. A couple of these agents are FDA approved for myelofibrosis, and And so they have been given to patients. We know the toxicities of these agents. And so this is just one example of how we might be able to approach novel methods of radiosensitization in the future by combining targeted agents to accentuate the effects of radiation. And many of these agents have minimal side effects with respect to the head and neck sites, and that's a real plus for radiation in these agents. Thank you for your attention.
So kind of the question is, are you going to take, especially in Insight with ruxolitinib? I mean, they're pursuing other solid tumors, so it sounds like this could potentially partner with them with cetuximab and may make a lot of sense. Are you looking at that?
We haven't initiated discussions yet, and we certainly would like to go that route. We were just kind of hit with the fact that Bristol Myers was doing away with their agent after we were moving along nicely, and so we have those plans, and I think it's a area that needs to be investigated.
Because they're also looking at it with their PD-1, PD-1 too. So
yep.
They're trying to do all those studies.
Yeah, that's exciting. So, other questions?